Tracheostomy suctioning. First step is to assess the need for suctioning every 2 hours. Indications for these are coarse crackles or rhonchi, diminished or decreased breath sounds, coughing, and increasing peak inspiratory pressure if the client is receiving mechanical ventilation. Do not suction routinely. If suctioning is indicated, explain the procedure to the patient. Check suction source and the regulator. Adjust the suction pressure until the dial reads 80 to 120 millimeters of mercury for an adult. Check the equipment used for pre-oxygenation, which may be provided by a reservoir-equipped manual resuscitation bag connected to 100% oxygen at 12 to 15 liters per minute. Perform hand hygiene and apply appropriate personal protective equipment, i.e. safety wear. Use sterile technique to open the sterile package and fill the sterile cup or basin with sterile water. Notice how she backed up away from her sterile field to don her first glove. That keeps her from sloughing any skin over her sterile field. She dons her second glove away from her sterile field as well. Okay. After putting on sterile gloves, connect to a suction source. Designate one hand as the contaminated for disconnecting, ventilating, and operating the suction control. She is designating her left hand. Assess the client's heart rate and respiratory rate pattern and color to provide a baseline for detection of changes during suctioning. If the patient condition indicates, pre-oxygenate using 4 to 5 breaths of 100% oxygen using the manual resuscitation bag. Lubricate the catheter tip with water and gently insert the catheter until obstruction is met. Do not apply suction during insertion and never force a catheter. After the catheter is inserted and cough reflex stimulated, withdraw it just slightly. Then apply suction while withdrawing the catheter. Manipulate the suction catheter by rolling between your thumb and forefinger while withdrawing. Limit your suction time to 10 seconds. Discontinue suctioning if the patient experiences cyanosis or heart rate changes. For patients requiring pre-oxygenation, oxygenate again with 4 to 5 breaths by manual resuscitation bag or ventilator after each suctioning pass. Rinse the catheter with sterile water or normal saline, and then to continue to suction the patient until airway patency is maintained. Always allow your patient to recover between suction passes. For tracheostomy care, she will dispose of her items from suctioning and then remove the dressing that is currently on around the stoma and the trach. For redressing the stoma, she will carefully, aseptically open her package. Pulling out the drape by the corners, allowing only 1 inch to be contaminated with her fingers, she will establish her sterile field on the patient's chest. Shiny side down. No, you're doing it right. Okay, carefully don sterile gloves. Can you see the cup? Okay, now arrange your compartments so that you're able to pour sterile saline and potentially hydrogen peroxide at 50% in one compartment. Sterilely obtain your Q-tip or cotton swabs and gently moisten them so that you can cleanse around the stoma in a circular fashion. If it's necessary, you may need to remove the inner cannula at this time. You can ask your assistant to open a sterile one for you. These are disposable at the St. Cloud Hospital, so you may go ahead and insert using a sterile hand. Now go ahead and redress your stoma. And that is care of a tracheostomy tube. Thank you and have a nice day.